Hello and welcome to my presentation on incorporating wearable activity tracking into prolonged exposure treatment for PTSD. This is an overview by myself, Ken Akers, on my thesis completed in December of 2021. I'll start by giving an overview of PECSS, which was the lab and research project that this thesis was a part of. Then I'll introduce some of the motivations for this work by looking at some selected literature. Then I'll go into the Fitbits and the broader PECSS ecosystem. Next, we'll look at the methods used in this study's experiments, and then I'll share some of the results of these experiments and discuss their significance. Finally, I'll conclude by summarizing the implications of this study and opportunities for future research. Now, PECSS, or PECSS, stands for Prolonged Exposure Collective Sensing System, and is the research project that this thesis is a part of. Now, prolonged exposure therapy, or PE, is an effective type of cognitive behavioral therapy for treating post-traumatic stress disorder, or PTSD. However, the lack of quantitative feedback on treatment progress burdens clinicians and frequently causes patients to drop out of treatment. As such, PECSS is a novel system that leverages ubiquitous computing techniques to grant clinicians better insight into treatment progress, thus aiming to improve the administration of this treatment. Moving into some of the motivations for this work, I've selected 4 key papers from the literature review section of this thesis. The first piece is that heart rate data may serve as a proxy signal for mental health conditions that are typically evaluated with the PCL5, PHQ-8, including PTSD. So this is one of the principal motivators for why we're looking at factoring heart rate data into the sensor suite of PECSS in the first place. Furthermore, research has shown heart rate variability to be an indicator of autonomic nervous system dysregulation, which is a key marker for PTSD. Now, more pertinent to this thesis, recent research has examined Fitbits in medical contexts and shown Fitbits to increase self-awareness, support social interactions, and facilitate giving back to other veterans in the same intensive outpatient programs, or IOPs. And in summarizing the motivations for our work, Nelson et al. In 2019 concluded that Fitbits, quote, appear to be useful for implementing ambulatory measurement of cardiac activity in research studies, especially those where the specific advantages of these methods, such as scalability and low participant burden, are particularly suited to the population or research question. Now, this is really important because while there are certainly more precise ways to measure heart rate, sometimes those methods are incompatible with the use case, especially when we're talking about out-of-clinic contexts, such as in vivo assignments. As with the rest of the PECSS sensor suite, we want to be as passive as possible in our sensing, such that we minimize patient burden. Now, while the tech stack behind the PECSS ecosystem is quite large, I want to draw your attention to the Fitbit portion of this system, specifically this portion right here. The work in this thesis leveraged several features that I and the rest of the team from the PECSS API team have developed over the past couple of years. Namely, this was building various models to represent these Fitbits programmatically and automating data sync between our own system and the Fitbit API. Part of this also meant creating ways to export this data so that other clients, whether that be other researchers or eventually other clinicians, so that they could compare this Fitbit data to the quote-unquote ground truth data supplied by the PECSS mobile app. In addition to this work, we also prototyped some Fitbit setup processes to make it clear how clinicians and patients themselves would be onboarded and offboarded in the system. Now, some of this work has already become useful for the literature review portions of the PEQ paper, which was another paper produced by some of the other researchers on the PECSS team. But in summary, the current Fitbit features that we are able to automatically pull data from the Fitbit API and store that in a PECSS-owned database on a nightly automatic basis. We can export this data via our API to a variety of clients, and we have built support for managing these Fitbits in the system, so we're able to assign Fitbits to specific patients that exist in the system. We are able to link and unlink them depending on how their patient trajectory is going and how the clinicians decide they want the treatment to go. And then finally, once a patient is no longer in our system, we have the ability to delete these Fitbits. Now let's look at some of the methods employed in the experiments of this thesis. So, although a deployment to Emory University's VA hospital was not possible during the timeline of this thesis, we were still able to test the usability of the Fitbits in PECS without requiring clinicians and patients. As such, this pilot study had three aims. The first being to collect heart rate data from participants in a variety of physically or mentally stimulating scenarios using Fitbits. The second aim was using this data and ground truth data from the PECS mobile app was to evaluate the efficacy of Fitbit integration during the simulated PE therapy, i.e. these in vivo and imaginal sessions that I'll get into later on. The third and final aim was to ensure that the use of Fitbits in these simulated PECS scenarios met user needs. So essentially, we were asking questions such as, how does Fitbit data compare to this ground truth data given by the PECS app? And is this Fitbit data sufficiently accurate for in vivo and imaginal sessions? To perform these trials, a convenient sample consisting of 9 of the undergraduate PECS researchers was formed to complete these trials. Each participant was randomly assigned to one of 4 groups, A, B, C, or D, and in each trial, the participant completed a pre-trial survey that gauged how frequently they perform cardiovascular exercise each week, they're susceptible to various phobias, and their hand dominance. These data points were collected to control for various measurements we observed. They then performed a mock in vivo activity, like walking or jogging, before watching a calming video to stabilize their heart rate. Then they viewed a mock imaginal video, which was designed to elicit either positive emotions, such as joy, or negative emotions, like fear. After a short break, they repeated the trial with the other in vivo and imaginal activities. Concluding the experiment, participants completed a post-trial system usability scale that asked them for feedback on the usability of the Fitbit and PECS mobile app in these mock exposures. And of course, a usability testing protocol was developed to ensure standardization across all of these trials. So now I'd like to share some of the key findings of the culmination of this work and frame them in the context of the 3 aims mentioned earlier. In furtherance of aims 1 and 2, on the left you can see a graph of Group B's heart rates over the trial period labeled with each activity. And on the right is the PECS mobile app's activity classifications while the participant was completing the jogging in vivo. So as we'd expect, the average heart rate for the jogging period was significantly higher than that of walking, which itself was higher than the average heart rate while watching the calming video, here labeled Serenity. This shows us that not only can the Fitbit discern whether the user is engaged in physical activity or not, but also the degree of intensity of that activity. This contributes an additional dimension of feedback for clinicians, who can use the mobile app's activity classification as a coarse indication of what homework segment was being performed, and then refer to the Fitbit data for information on how stimulating the activity was. It's important to note, however, that this pattern was less robust in the mock exposures, that is, when they were watching various videos. The audio metrics also yielded promising results. Here you can see a graph of participant 1's in vivo 1 audio data, and the audio metric of choice here was max amplitude. When the participant was instructed how to perform the exposure, the maximum amplitude increased accordingly. Similarly, we observed a period of decreased amplitude while the participant was jogging or walking. These data serve simply as a proof of concept that the phone could effectively measure periods of speaking, which is one of the intended use cases during clinical sessions. Regarding the third aim, participants gave the system an average system usability score of 78.89, indicating a positive usability experience compared to the average system usability score of 68. However, participants still reported problems while performing the mock activities, suggesting several opportunities for improving the usability of the system going forward. We learned that screen rotation should be automatically locked while completing assignments, and that Android navigation buttons should be hidden to avoid confusion. Participants should also be given the option of regular versus extended watch bands to accommodate various wrist sizes. Most importantly, however, since activity data is not automatically uploaded to the PECS servers following the completion of an assignment, which is an intentional design choice to preserve patient data privacy, users must still be prompted with the choice to sync their data so that they are more aware of the ownership over their own data. In conclusion, the findings presented in this pilot study serve as evidence of the usability of the system and supports previous research into the affordances of wearable technology in clinical settings, specifically for heart rate sensing in physically and emotionally stimulating situations. That said, there are opportunities for future research going forward. The major limitation of this study is the lack of PTSD patients evaluating the usability of the PECSS mobile app and Fitbit during prolonged exposure treatment. Future work should explore how the mobile app's UI can be improved to increase usability for this specific population. Furthermore, previous research has indicated a correlation between the tonality of speech in PTSD patients and the response to trauma. The PECSS system should be deployed in real imaginal exposures to explore whether the audiometrics can capture this phenomenon. Thank you for listening to my thesis overview. I'd like to give a special thanks to Dr. Rosa Arriaga, Peter Presti, and the rest of the PECSS team at Georgia Tech.